is Clan Academy, ready to present to you a poem entitled The Unknown. So sit back, relax, and tap your collars. They say when you eat chicken, you get chicken pox. When you steal answers, you get cancer. If you continue to tie your head high, you get typhoid. What about when you like harvesting potato tubers? You get tuberculosis. Aha! Cough in the morning, cough in the evening. Tiredness all the time, fever and poor appetite. Oh no! What is this? Could it be malaria or rabies, asthma or tuberculosis? Oh, this endless cause. Where can I find the cure?
It is very important that we are celebrating this day. We want to thank the national government for recognizing Kiambu County and giving us this opportunity to be able to host the national function. In addition to that, we would like to recognize the fact that you have chosen the best agent of change. In so many other incidences, we have tried to use other mechanisms of getting the message home. And today we are very proud the fact that we are using the school health program to reach out the message. Because the children, our children, are the best agents of change.
Na kwa sababu tumewaita hapa ni kuwa tunataka vile wamesema mbele yangu, mkienda nyumbani muweze kueleza wazazi, ndugu zenu, dada zenu juu ya dalili za ugonjwa wa kifua kikuu, sawa? Ugonjwa wa TB. Ndio mtu yoyote ambaye ako na hizo dalili anaweza pimwa na kupewa dawa. Kwa hivyo kuna kipimo ya TB na pia kuna dawa zake, na kwanza kwa watoto dawa zake ziko na ile test mzuri.
Kwa majina ni Sara Wamaitha ama Mama Revis. Revis ndiye mgonjwa. Alianza tu kuwa mgonjwa, kutapika, fever. Nikakuja hospitali, akapimwa. Finally akaonekana ako na TB. Sasa kutoka hapo akaanza treatment huko Kiambu. Amekuwa akikunywa dawa na hizo dawa zimemsaidia juu sikuwa najua nilikuwa naambiwa ni tonsil. From that when alifanyiwa test akaambiwa ako na TB.
My name is Elizabeth Mungai. I work at Kiambu District Hospital Chest Clinic. Sarah came to me back in December. She came with Lewis, who had been treated for tonsillitis for like 3 weeks. And the baby presented with a swelling on the left side of the neck and was running fevers, which had been treated with antibiotics but were not responding. So we sent Lewis for an FNA, which is a test we do for the lymph nodes. We also did a blood test, and we also did a HIV test and a MAN2 test. So the FNA came out positive for TB. The full hemogram also showed some infection. There was increase in the WBC, and also the ESR was on the higher side. The HIV status was okay.
Watu wengi wanasemanga that ukiwa na TB lazima uwe na HIV. So that's why mtu atilikuja atinikwambia ati mtoto wangu ati ako na HIV ya TB, atachukulia labda hata mimi niko na HIV. TB hailetanangi na HIV. Juu nilipimiwa HIV nikaonekana HIV sina. Na sasa hapo sasa nikawa comfortable.
So we started Lewis on treatment. That was on 27th of December. So the first phase of the treatment was 2 months of RHZD, which is a combination of treatment. The RHZ is a combination, a tablet, that we also combine with another tablet because we don't have a fixed dose combination for the first 2 months. So he's been okay with the 2 months. Then currently we've already changed him to the continuation phase and he's doing the 4th month. The baby has been doing well. In fact, like the swelling has reduced completely. The fevers have gone down, but at times he usually presents with a bit of fevers. And the baby has been able to tolerate the medicine compared to what we used to use initially. Because like the mothers would come to me and complain about vomiting, a lot of vomiting because of the treatment. For Lewis, we've not had that challenge except for the red color in urine, which is normal with the TB treatment, and we've been able to reassure the mother. Otherwise, the baby is doing well, and they usually come for their treatments every week on Tuesdays. Yeah, because we usually give the drugs weekly. TB in children is a bit tricky because the symptoms are usually a bit different compared to the adults. Because the adults are usually more pronounced, the cough is more pronounced, they will always complain about the night sweats and the weight loss. But for children, we really depend on the mothers to give us the history concerning the child. And sometimes the mothers are not very familiar with some of these symptoms, so some of them will just not tell you until you probe. So my cry out there is that clinicians out there, in the private hospitals, in the government hospitals, we should always we probe for these symptoms, especially in children. Let's do the examinations because like Lewis just presented with a neck swelling, which was treated as tonsillitis for around 3 weeks. And the fevers were not going down, the child was losing weight, and the appetite had really disappeared. So the symptoms, some of them just are like for the adults, but there are some that as a clinician you really need to look out for them. So TB in children is really about the community, and we are addressing that all adults who are at home, when you're coughing, we should use a proper cough etiquette because TB is an airborne disease, and children less than 5 years are more likely to get TB because of their low immunity. And again, you see children under 5, they are the people who really want close proximity, either with their parents or even if it's an uncle who is at the same household with the child. So we are advocating that any person in a household who is coughing should use proper cough etiquette and should be investigated for TB. And we are also advocating that when a person is diagnosed to have TB, that they should bring out their children for testing, because we are really encouraging that. We are doing contact tracing to all our smear positive patients. Yes.